the artery and you say, "Aha, I see some veins here." So you've got a pretty good idea of where your veins are. You're going to put your tourniquet on.
You got
And you just saw how I did that. You just take the two ends, pull, and put one under the other. That's as simple as it is. So that when you pull it, it just comes apart really easy. So do that, tuck it under, just like tuck in the part so that you have a part that you can pull. You're going to see your IV. Let's say we're going to start it in any of these great veins here. Got your gloves on. You puncture this one. You're going to clean the site, clean to dirty, round and round. You're going to pick your catheter side. If you're going to give blood, you're going to have to give the largest gauge, which is an 18. But that's not the easiest one to start an IV. Your smaller gauges, your 22 is probably your ideal one if you're going to just start a running IV. And the one in between is a 20. So these are two big ones. This is a 20. You have on your pediatrics some very difficult patients. You have a 24, which is a tiny little one. So we'll pick, let's say pretty standard is a 20 or 22. And pick your catheter. I guess we're going to open these. It's called your angiocath. You take a look. You see where you see the bevel? Does everybody see that? When I turn it around, you see where there's a little bevel on there? You want that bevel to point up so that you can see the bevel on the tip. And of course, this plastic thing is on top of this bevel. That's what actually goes into the vein, so you don't want to touch any of this. Pick your vein. There are two ways you can do it. Some people come in from the side and go into the vein and move sideways. Other people come down and into the vein. Personally, like to go in by the side because going in at this angle, you're not terribly sure how deep that is. So you want to secure that vein. Sometimes you can see the vein and guess what? They move around, they roll to the side. So you may want to secure it with your hand so that vein doesn't go from side to side. So you've cleaned it, you come in with that bevel up to the side and you're coming in. And you should see some blood return. If you see blood return, then you know that you're in there. You can advance the catheter, pull this out. Somebody can help you and attach your tubing to this little angiocath. And then you would loosen up and flush. And of course you would tape it. And this is your transparent dressing. And there are different ways you can tape it. Your facility will tell you how they want it done. Some places have a little contraption that you just snap on to keep it in place with little wings. Others, you have to take the tape and you have to actually cut it yourself. And again, there's different ways you can do this. Some of these catheters have little wings on them. You can go like this over the wings so that it is positioned in this manner. This one does not have wings, so you may just have to go right over it like this. And you're going to put your little dressing on top. I don't want to use this because this must be somebody's kit, and you can't put this back together again, but you can feel that this is where you're going to put it on top, just like that. And your IV will be infusing.
Does it matter whether you take the needle out before you release the tourniquet? Because I know she said to release up there and then pull the needle out.
I think the most important thing is you don't want to flush it with the tourniquet on. When you have the tourniquet on, you're going to have the vein is engorged in this area, so you'll have the return, but you don't want to be flushing at that point, and you can only flush when you pull the needle out. Does that kind of make sense? Some people want to advance it with the needle in. I don't recommend that, because when you advance it, this needle can come out the other side. And this is an extremely long needle. Usually they're not this long. They're about 1 inch to 1.5 inches long. So
and they'll like sometimes they'll like draw it.
and this is what goes in the patient. You're going to tell the patient you're going to feel a stick, but you're going to take that needle out. So this, after you put this in, it should not hurt. Just that initial going into the vein with this needle is what hurts.
Occlude in the vein from the bottom, is that what keeps the blood from, where do you occlude at?
You're actually occluding from here, so the blood is pooling in this vein, and when you put it in, that's when you're going to see the return.
But if you pull the needle all the way out, won't the return come out of
It will.
That's why you gotta hook it up before
Yes,
something.
exactly.
And she said,
Hook it up, or if you're drawing blood, you're going to take your syringe and put it on here and draw back your blood. Now, she had a contraption that they use, the phlebotomists use that contraption that goes in directly, and then you put the tube on and snap it on. That way you can take a tube, snap it on, it will fill, you take the tube off while that still remains in the vein, and you take your next tube and fill it.
I guess my question is,
Yeah.
before you hook it up, while you're trying to get whatever, if you're by yourself, before you hook it up, what do you do about when you pull that needle out and blood coming out while you're trying to hook
Yeah.
it up?
Well, you know, if you're there by yourself, you got to secure that with your finger or a piece of tape immediately before anything, because it's going to fall out. So that's when you secure that, after you've advanced it and pulled it out, you can put your finger a little bit here to stop it.
Oh, okay, a little bit pressure.
Yeah, and it will stop flowing, but it is going to flow out a little bit. So put a little,
Pressure.
maybe a paper towel or chuck or something underneath here, because it will come on the bed, which you don't want. But it will be flowing out, so you've got to coordinate it. Hopefully you have a person with you, because you have to coordinate it. Hold it so it doesn't come out of place. Put your tubing on there and flush it all by yourself and release it. So you've got to get coordinated, but hopefully someone is there with you to tape. Because it is pretty difficult to do, especially when you're just learning, or if you have a patient that's not too cooperative.
it won't come pouring out, will it?
Sometimes it does come, yes, but it's not a huge amount. It looks worse than it really is. What you're seeing come out is not a huge amount, but it looks scary.
How did you do the wing thing with the tape?
Well, there's different types. This is a angiocath that doesn't have little flat pieces on each side. A lot of the hospitals have them. It looks flat like this, and you will take this, the sticky side up, put it like this.
Before you do it?
You want to do that for the very
The
first
sticky side is going to
yeah.
be on the bottom half of the wings that are
Yes,
there,
the wings
so that
will
it
be here.
goes over the wings.
Okay. Okay. So you have to have it under there before you ever put it in?
Well, you'd have put it in, and then you would take this and put it under.
Okay.
Yes. Does that make sense?
Yes, ma'am.
But this one does not, so you're going to have to either go like this, where it's similar to what you'd be doing with that NG tube. Remember, everybody asked about how you tape that? You can do it like that. You can tape it over one time, or you can have a little contraption. She showed a couple contraptions where you just fasten it on top. And here at East Georgia, they have a little snap lock that you put on top there, snap it, and it's tape on the sides.
Will a snap lock stop the blood too?
It probably won't, but I'll tell you one thing. If you don't prepare the skin, it's impossible to get that off without an alcohol swab. It's stuck on that skin, and it's a nightmare getting off. It's kind of like what you have the Foley catheter stuck on the thigh with, only it's smaller, and it's very sticky, let's put it that way. It's very tough to get off. So I really personally prefer the tape, but you know, if your hospital has a thing where you have to do it one way or the other, then you've got to do you know, what they say.
So that's all for that.
That's it.
That's
And then
seems
just
easy.
follow the directions for, I mean, remember, go in that order, exactly that order, as you know. The extra gauze is like if you are, you're not able to get it in, if it comes out, the vein blows up or something like that, you would put this on and then put a piece of tape over it, just like a Band-Aid. But you wouldn't use the gauze when you, if it did get in and you were taking it with the occlusive.